Hello, my name is Dr. Lars Eric Larson, and I'm a chiropractor. In the next 30 minutes, I'm going to review some fundamental health information that's applicable to everyone. Some of my talks are very specific, but they all involve basic health tenets. My mission is to educate and check as many individuals and families in my community in regards to their spinal health and those conditions associated with spinal health. Now, today's topic is going to be carpal tunnel syndrome. And I've prepared a slideshow, so let's start by taking a look at our very first slide. As you can see from this picture, it says carpal tunnel syndrome, the occupational disease of the 21st century. Now, it used to be thought that carpal tunnel syndrome could only be created through hard labor or jobs that involved hard labor, such as swinging a sledgehammer, or maybe using a jackhammer all day, or maybe even shoveling. So something where the wrists were really in motion. Now, what we've learned, though, is that this is truly an occupational disease, and many, many more people are in fact affected. As the picture shows someone typing, this is an example of a repetitive task that actually could lead to carpal tunnel syndrome. So what we're going to do in our next 30 minutes is talk about who is affected, how they're affected, some of the anatomy of the body, how to prevent carpal tunnel syndrome, and also what to do in case you do have it. So let's look at our next slide. Now, it says, who is affected? Do you work on a computer? Do you drive a car? Are you carrying bags or boxes? And do you sleep with a bent wrist? Now, as you can see from that list, those are some simple tasks or some simple positions to be in, but it may in fact be causing carpal tunnel syndrome. Now, maybe you're sitting at home and thinking, well, I don't have any wrist problems. I don't have any pain, so this material doesn't apply to me. Well, I hope you'll stay with us and see that this information really is applicable to everyone, because right now you could be creating the conditions for carpal tunnel syndrome in your own body. Let's take a look at our next slide. What we'll find out is that work is affected, the workplace specifically. Over 52% of all work injuries are now considered to be coming from carpal tunnel syndrome. It has the highest number of lost work days, and it often results in temporary or permanent disability. Now, if there are any managers or business owners, small business owners in the audience tonight, you'll realize that workers' compensation insurance is a big topic these days because it costs a lot of money. So when people have injuries, specifically carpal tunnel injuries, that may affect not only that individual, but also the workplace, other employees, but also the bottom line in companies, and that eventually affects all of America because we all end up paying for high insurance rates. So if there are any managers or owners out there, I hope you'll pay particular attention and try to learn about how these symptoms and this condition are caused and what we can do to prevent it. Let's take a look at our next slide. Let's look at some of the anatomy of the body, in this case the wrist specifically. And this says 8 little bones, 1 big problem, and then it has an arrow pointing to the wrist bones and what's called a binding ligament. Now, the bones of the wrist are called the carpal bones. And what happens is there's 8 little bones, all individual names, and they form a semicircle pattern in the wrist. And for our purposes, that's going to be the roof of really a tunnel forming right in the wrist. Around the wrist wraps a binding ligament called the retinaculum. And it's very strong, and it holds everything in place. So that's going to be the floor of this tunnel that we're going to talk about. And on the next slide, you'll see a drawing. So let's go back to our slideshow. And here you'll be able to see the drawing with a tunnel right through the wrist. And it says it's designed to bear heavy loads. And the wrist is designed to withstand highly repetitive tasks. And the wrist is designed with a curve to provide space for nerve flow. Now, through that tunnel comes the vein, the artery, the nerve, and all the tendons that go and supply the hand so it can do all of its functions. And what we'll see is that those structures can be affected inside the tunnel. And one of the things that affects it would be a misalignment in those carpal bones, specifically one called the lunate. And what can happen is the lunate bone can slip or fall down and affect the nerve traveling through the wrist. Now the nerve there is called the median nerve. So that's one thing that can happen. Also, the ligament underneath could be affected by repetitive tasks and start to swell. So you could have pressure rising from the floor, closing off space, once again, for the nerve and the other structures. Let's take a look at the next slide. This gives a representation of the tunnel collapsing. And it says, misalignment of the wrist bones places pressure on the median nerve. So that gives you a good example of what happens. Actually, the arch, the keystone to the arch, possibly that lunate bone, falls down and starts to put pressure on the carpal tunnel. Now, when that happens, you may start to get symptoms. So, carpal tunnel syndrome is defined by possibly pain in the wrist or the hand, or possibly pain and achiness in the forearm. Could also be numbness or tingling in these first three fingers, which are supplied by the median nerve. You could also have a loss of grip. So those are some of the symptoms that might show up if you have carpal tunnel syndrome. However, the median nerve can be affected in another place, specifically right here in the neck. Now remember that the brain is connected to the spinal cord, and the bones of the neck are surrounding the spinal cord. Well, that median nerve has to exit the bones here and travel all the way down your arm to your wrist. So let's take a look at another structure that might put pressure or cause problems for the median nerve. And I have a chart that I'm going to have us turn to right now. As you can see, this chart is of some neck x-rays, and it shows a normal neck on the left and an abnormal one on the right. And I'm going to point out this big black line here is the normal curve. This is the back of the neck, and this is the front. And both of these pictures, the head is facing forward. And what you'll see is the normal curve should exist. Nice concave curve with big black spaces in between the bones, and those are the discs, and that's normal and healthy. The second curve is abnormal, and that's because there is no curve. You'll see by this red line, the neck is actually pushed behind the curve and in fact is very straight. When this happens, you may start to get conditions like arthritis. You'll start to get changes in disc height, so the disc will actually collapse. And then you might get spurs, and that is really the definition of arthritis, where the disc starts to collapse and you start to get little spurs in and around the disc and on the bones. Now let's go back to our slideshow and take a look at one other slide. And this shows the nerves coming down from the neck all the way down to the wrist. And it says, nerves flow from the neck down, and they might be affected by misaligned neck bones or a lack of curve in the neck, what we just talked about. You could also have the shoulder structures pinching the nerves, such as a bone or a tendon or muscle actually causing pinching in the shoulder. And then, of course, the elbow tendons could swell, and we might, in fact, have swollen elbow tendons, and that would also cause the same type of symptoms down in the wrist. Now, it's important that we go over this information because a lot of people that have carpal tunnel symptoms actually have the problem in other areas. So as a chiropractor, we want to make sure that we're not missing something. So we want to look at the neck and the shoulder, at the elbow and the wrist, so we can rule out some of these areas and actually find the correct diagnosis for what's causing the problem. Now, what else can affect the median nerve? Of course, we went over the curve in the neck. Well, how is the curve affected? One thing I want to mention is posture. Poor posture, and I'm going to demonstrate a couple positions here, could actually affect the curve in your neck. So that's how you would lose your normal curvature. Now, I'm not suggesting that posture is the cause of carpal tunnel syndrome, but what I am suggesting is that poor posture would definitely affect the curve in the neck and could place pressure, causing problems for the median nerve at the neck. I have another chart, and let's look at posture. As you can see from this chart here, there is a normal. The ear should be lined up with the shoulder. So your posture in your upper body, your head should be placed right over the shoulders. And we can see from our second drawing here is that the head actually gets out in front of the shoulder. That's where the problem first starts. Now, that is entirely correctable, but as the condition goes on, as you lose that awareness and as you basically give up, that head gets farther and farther out in front of the shoulder and may start to change curves, cause arthritis, may even start to get painful. You might even have back pain because of this, because the head is so far forward. In the last picture, we'll see something that's very abnormal. That's that stooped posture that you might have seen in public. And in that case, there definitely is loss of curve and arthritis, and most definitely other problems, because what's happening is the nerves are being pulled and twisted and stretched in that abnormal position. And it says underneath, to live a long, active, energetic life, few things matter more than good posture. That's true of all your health. And of course, this may affect the curve and lead to possible symptoms all the way down in the wrist. Let's go to our next slide. And we're going to look this time at wrist posture. So we've done the neck posture. Now let's look at proper wrist posture, because there is a correct one. And it says, don't bear weight with a bent wrist, and keep your wrist straight. So let's go over some of these positions. As you saw on the slide, a correct wrist posture is to keep it linear. Now, when you're doing repetitive tasks, it's not that the wrist can't bend and do it, but you don't want to do it over and over for many weeks, months, and years, because that can lead to symptoms actually in the wrist. Now, if you have to bend your wrist, you're going to want to do it as little as possible and try to get back to that linear position. And that includes things like typing or carrying things or using tools. Now, as a chiropractor, I'm using my wrist all the time, so it's really important for me. And I can't be turning my wrist and adjusting people in that bent wrist position. So I have to be very careful not to cause carpal tunnel syndrome in my own wrists. Now, there is a simple test that we can do, and that would be called Phelan's test. And we can just try one wrist here, and that would be to apply pressure in this position, flexed wrist, and hold for 30 to 60 seconds. Now, if you develop symptoms from doing that, such as pain or numbness and tingling or wrist pain, loss of grip, that may indicate, in fact, that carpal tunnel syndrome has already affected your wrist, and you may need to get that properly checked. But let's take a look at our next slide. What happens if we do that test and, in fact, no reaction occurs at all? This does not mean that you're safe from carpal tunnel syndrome, but it does confirm that at this moment there's no likely inflammation in your wrist. However, if we check your posture and found some neck and shoulder distortions but no pain, this does not confirm that everything is fine without the pain. If your posture is distorted, it is possible that we're placing some pressure on the nerves which leave the neck and travel to the hands and the wrist. Let's take a look at our next slide. If you are in fact having symptoms, we don't want to ignore the warnings. If you're awakening at night with wrist pain, if you have clicking in the wrist, painful wrists, or a feeling of numbness in your hands, this is a serious situation. So if in fact you do that test at home or in a doctor's office and you have those symptoms, that may actually confirm that you have some carpal tunnel problems. So we're going to want to get that properly checked. But we're also going to want to know what our options are and how to prevent this from getting started. In fact, if you have the symptoms, though, it may be a little bit beyond doing some simple prevention, because now we've actually got the symptoms. Let's take a look at our next slide. So how do you use your wrist? Are you typing, driving every day, writing, using tools? Do you lift or carry boxes and packages, trays, even children? Well, let's do a simple exercise and think for a minute here. And let's look at our next slide. If you engage in any repetitive work with your hands, raise your hand now. If you engage in any long-term holding of things or controls, raise your hand. If you spend a large part of the day writing or typing, raise your hand. And if you spend many hours a day driving or controlling a car, raise your hand. And my question is, who out there in the audience has not raised their hand? Everyone else, in fact, is a candidate for carpal tunnel syndrome, and that includes me. So I would have to put my hand up in this instance because I'm using my wrist every day to help people doing chiropractic adjustments. So once again, I've got to be very careful of the placement. But just because I don't have wrist pain doesn't mean that I'm not creating the conditions for carpal tunnel syndrome. Let's look at our next slide. Here's an interesting statistic. To date, there is no research confirming that boxers result in a grossly higher percentage of carpal tunnel flare-ups. Now, what do you think the reason for that is? I'll let you think for a minute, and hopefully some of you have gotten it. Boxers stress the wrist in a straight position, and they strap or brace the wrist before such activities. So the primary agenda is to prevent injury by humbly accepting that you are continually able to create the injury. Well, let's look at our next slide, and let's talk about prevention, because there are a couple things that we can do to prevent carpal tunnel syndrome. If we are using our wrists a lot, we can ice the wrists. We can wear a brace for protection, and we can even wear that while we're typing. We can improve neck posture and improve the curve by getting chiropractic adjustments. And we don't want to wait for the pain. We want to exercise our wrist now. Now, when we talk about exercises, you would want to do that before you have a lot of the symptoms. If in fact you are having a lot of symptoms, it's possible that the exercises, moving the wrist back and forth in the opposite position that you use it every day, may in fact cause more of a flare-up. So these are preventative things that you can do. Let's look at our next slide. And let's consider some options. See, we can use splinting or bracing. We can ice the joints. We can get wrist adjustments. We can do wrist exercises. And we can improve your wrist mechanics and maintain a healthy neck. And that would be by getting chiropractic adjustments and watching our posture. Or we can ignore the whole problem, right? We can just forget about it and say it doesn't exist. We can use medications to cover it up, or we can use surgery. But let's look at our next slide. What happens if we compare anti-inflammatory drugs and surgery versus conservative adjustments, bracing, and therapies? Well, option one is to cut open the flesh, the ligaments, and the tendons to form the floor of the carpal tunnel to relieve pressure on the median nerve. Once the tunnel has been cut open, the misaligned or subluxated bone will still push upon the median nerve, but no counter resistance. This reduces the likelihood for pain tremendously. However, does this correct what caused the pain from the beginning? I would say not. And let's look at some of the side effects from medication and surgery. You could have increased instability of the functional units of the wrist. That's the bones and the tendons and the ligaments. You could have scar tissue from surgery, and it can keep growing after the surgery from opening up the wrist. You can have weakened connective tissue due to cortisone injections. You can have an altered organ function and reduced immune system from taking a lot of medications, anti-inflammatory medications. Osteoporosis can certainly creep in from taking cortisone injections because it leaches the calcium from your bones. And here's the big one. It falsely reassures the patient it's okay to use the wrist more than is safe to do so. And that's the biggest problem I see with medications. So which will you choose? Let's take a look at our category of vital needs. This is an important slide because it shows us that what we think of is important, we might have missed something. And the first thing we always think about is food, right? Food and beverages. But you can live a long time with food, or without food, excuse me, and you might be able to go up to 90 days and still be alive without eating food. Now, water's a little different. A couple of days, 3, 4, 5 days, we're in big trouble. Oxygen is only a couple of minutes. So oxygen is even more important, and oxygen comes from exercise as we increase motion in the body. But the most important thing is nerve flow. And nerve flow is important because if you interrupt the nerve supply, especially at the spinal cord level, you will in fact not be around very long. So that's your categories of vital needs, and I hope everybody thinks about that because nerve flow is the most important thing. Now, what do you do? Let's look at our next slide. What do you do that enhances the quality of messages sent from your brain to your body parts? Once again, emphasizing chiropractic adjustments and nerve flow. Do you continually check your posture? Do you do posture maintaining exercises? Do you constantly adjust and retune your workstations, your car seats, your bed and pillows, and your computer screen? Do you have your spine checked for subluxations? Now, in closing, what I'd like to talk about here, I hope you've learned a little bit about carpal tunnel syndrome. To recap, let's talk about the structures. First, there are the carpal bones, forming a semicircular pattern in the wrist, bound by a ligament that holds everything in place. Now, you can have a dropping of one of the bones, called the lunate bone, into the tunnel, causing symptoms in the hand. You could also have swelling of the ligament causing the same symptoms. Now, what would those be? Possibly pain in the wrist or the fingers, achiness up in the forearm, loss of grip or sensation in the fingers, and possible numbness or tingling. If we have those symptoms already, it may be that you do have a true carpal tunnel syndrome. However, they can be masked by a condition in the neck, loss of curvature and bone neck subluxation in the neck, causing the same thing. Now, if we do want to prevent carpal tunnel syndrome, what can we do? Well, we can keep that wrist in a linear position. We can watch bending it when we're doing repetitive tasks, and we can do things like bracing the wrists. We can ice down the wrists after using them a lot, and you can go to a chiropractor in order to get wrist adjustments and neck adjustments in order to prevent this from occurring. If in fact you already have carpal tunnel syndrome, you may want to consider some of the conservative options, and that would still be things like icing and bracing, not using the wrist, laying off them for a while, and asking a chiropractor's opinion to make sure that in fact this is truly carpal tunnel syndrome and not something at another level, such as the elbow, the shoulder, and most importantly, the neck. I hope you've learned a little bit today. If you'd like to contact me, I'm on Pine Street in Burlington, and my phone number is 951-5700. Thanks, and have a great day.